ONJ, it's a new term and it stands for osteonecrosis of the jaw. Osteo means bone, necrosis means death, and jaw is obviously the jaw. And so what happens is that you get the weakening of the jawbone around the tooth, and you get destruction, which results in pain and often associated infection. It's a new disease which has really come out of the use of particular types of drugs that are used in cancer, where cancer's affected the bone. And that's a group of drugs called the bisphosphonates. Now in myeloma, the most common bisphosphonates used are zoledronic acid or zoledronate, permidronate, and another drug called clodronate. And these have been hugely important drugs in the terms of myeloma, because what they do is that they've really turned around the control and the healing of bones. So they're critically important, and they have really changed people's lives with myeloma, reducing a lot of the side effects. The problem is that the bones, although it seems strange, are constantly remodeling. So they're constantly breaking down and rebuilding as a way of fixing and adjusting to the natural changes in our body. And what happens is that teeth are connected to the bones. So as a result, whenever we chew, there's a little bit of remodeling, a little bit of destruction and a bit of replacement. But what happens is that with the bisphosphonates, that can actually reduce that constant remodeling. And so that can result in some destruction. Now, it's uncommon. We think it's about 1% or less of patients who receive these bisphosphonates. And the major risk factors are length of time on a bisphosphonate, but probably more importantly, general dental hygiene. So we make sure people keep their teeth clean, avoid caries, certainly avoid smoking, and also if they do need a tooth removed, the doctors, us, we need to know about it, because it may help by discontinuing the bisphosphonate for a period of time before and after. Usually things like a tooth clean or even canal work is fine. It's usually only a problem if the actual tooth is removed. But it can occasionally occur spontaneously. So if patients have jaw pain, they should seek their dental advice pretty soon.